Okay, we're going to shine a light and we're going to shine them upward through here. See if there's translumination of them. And then we're going to shine them down. Can you open your mouth? Okay. Now some people you cannot see translumination, and I really don't with her. And this is really not a diagnostic finding of her sinuses. First, one thing we want to see is that they're equally positioned on your head. And I'm going to use your card, and I'm just going to have you tilt your head forward that way. And I want to close your eyes for me. I'm going to put my index card there and make sure that they sit a little bit higher than her eye. And then if you measure up and down this way from the mandibular process up, they are back at least 10 degrees. Let's do this side over here. We're measuring from the corner of the eyelid. They are above the eyelid, which is normal. And then starting with the mandibular process. And then it sits also back 10 degrees. So look at the outer part of your ear. I see no redness, swelling, or lesions. She has an ear piercing, though, in this side. And I'll go ahead and palpate this ear, okay? The lobe down here, as well as the auricle and the tragus. Did you feel any tenderness with that? No. Okay. And I feel no lumps or nodules in the back. No foreign bodies that I can visualize out here. On this ear, she has an earring in. She didn't have an earring over there. An earring in over here, and she has an ear piercing. The lobe. There's no nodules palpated. And the tragus of the ear. No lesions, no swelling is noted with any of this. Her ear on the top of the ear, the tragus of the ear. And look down in there. I see no cerumen, no drainage or no lesions are noted. Now I'm going to advance a little bit farther, Carlina, so I can visualize the tympanic membrane. It is a gray in color. You have some white on yours. Have you had ear infections in the past? Flat and it's intact. It's a pearl gray in color and it's glossy. External canal first. Redness on this one. No foreign objects is noted in either ear. I see some whiteness again. And the eardrum is intact. It's flat, not bulging. There was no overlapping of the vessels near the disc. I think I told you what the AV ratio was of what I saw. On the right eye, I could not see the macula. There was no pulsations that I saw within the vessels, and they were not tortuous in any way. 6B A. 6B A. Okay. Now let's try with the other ear. Do the same thing. 6B A. 6B A. Okay. And this is the Weber test. I want you to tell me when you quit hearing it. And I'm going to time you with the clock on the wall. Okay. Stop. Okay? Okay. That was 10 seconds that she heard it. Now we're going to do it. Stop. Stop. Okay. Stop. Stop. Nose. There's no lesions or redness or any white patches on her nose. There's no drainage, no foreign objects is seen, and no redness. Now I'm going to look up in there. It is red pinkish red, very moist. I see the inferior. And note that they're kind of dry in appearance, but there's no blistering, no redness or swelling of either lip. And we'll pull your lips down just a little bit and look behind them. Okay, it's very pinkish red. I see here that she has gingival margarine, which is common for your race. And upward, there's no blistering behind her. And her tone of her lips are the same. Okay, we're going to open your mouth, and I will look inside. Now I want to count your teeth. Tip down. Here she has 19 teeth, and this is a partial. Okay, her teeth are clean in appearance and they're white. She has golding in the front of her teeth by choice. And then I believe your back tooth may have a cavity. It has some dark area on it and a little bit of yellow back in your back molar. Okay, raise your tongue for me. And I'm looking at the veins, and I see two pairs of veins there, or a pair of veins. There's two of them on there. And there's no redness or swelling in the lower of that. Let me look at the roof of your mouth. You put your tongue down. It's a little bit lighter in color, the roof of her mouth is, but still no blisters or anything adverse up there. So stick your tongue out. You can swallow if you need to. Stick your tongue out. Her tongue is rough in appearance, has a little bit of whiteness on it, which is normal to be. Okay. The sides of her mouth. Now her mouth is a little bit tinged of a purplish gray with the pinkish, and I believe that's just consistent with her skin tone. I see no redness or lesions on her buccal areas. I'm able to visualize with the placing where her second molar would be. I see the Stinson's duct on the left side, and then let's see if we can see it on the right. And I also can visualize it on the right side as well. Okay. I'm just going to take a 4x4. I'm just going to kind of palpate, so if you open your mouth, make sure that we have no. Can't feel any swelling in her mouth. I don't want to gag you. Okay. Her mouth is very moist, and the appearance is equal throughout. You're a little bit, more gray color on your buccal over here than you are on your tongue. Okay. Now I'm going to have you say, open your mouth so I can see the back of your throat. All right. And her uvula is midline. It's a pinkish color, no acute redness. Her tonsils, I would grade them as a 1. There's no exudate on them. There are no plaques. A little bit of the fissures are within the tonsils, which is normal. The right tonsil is a little bit larger than the left one. Now, can you say ah for me? Ah. And the uvula goes up and down on her ah. Okay, very good. Mouth was moist and normal, except for the dental carie, I believe, that she has on the left side. Laryngeal wall. Say ah. Ah. I see some veins back in there. A little bit of brownish color.